talk in the U.S. Senate of a possible agreement, at least among Democrats, on a bill meant to lower prescription drug prices. What this bill would basically do is allow the government to negotiate prescription drug prices, also set some price caps on prescription drugs. Okay, so the importance of saving on prescription drugs, that's important to all of us. And emotionally, a top-line review of these proposals makes you think, okay, maybe this will work. But pragmatically, will it work? Well, that's why I go to my guy from PCS Advisors, my healthcare expert, Paul Seegert, back on the Newsmaker line. Paul, welcome back to Iowa Radio. Good morning.
Good morning. Thanks for having me.
So, Paul, in a real pragmatic sense, will these proposals by the Senate Democrats work in lowering prescription drug prices?
Well, this is a conversation we get to have a lot. There are lots of bills that get proposed, and yet drug prices still seem to continue to go up. Lobbyists are good at what they do, so I'm not hugely optimistic. It would have to, make it through the process there on Capitol Hill. But if it did, I think, like is so often the case, they're focusing on not necessarily focusing on the real problem. Manufacturers that make drugs get less revenue each year on lots of these drugs that they make, even though the prices go up because of the other middle players in our supply chain and our delivery process who add so much of the cost. Pharmacy benefit managers who manage the formularies and are currently tasked with negotiating drug pricing have become a huge source of waste in our system. Insulin is an example that gets talked about a lot. 60% of the cost of insulin is added on after the drug is manufactured and leaves the manufacturer. So are we going to address that? If we're going to address that, then we've got a real chance at doing something substantive, but not surprisingly, that seems to be absent from this conversation.
Well, it's interesting you make that point, Paul, because the Iowa legislature in its last session did actually pass a reform bill dealing with pharmacy benefit managers. And when I would have guests on, I'd say, okay, we really got to get into the weeds on this because this isn't easy to explain what their role is. But states like Iowa are trying to pass bills to reform the process. What is the problem, Paul? I would suspect Congress doesn't want to touch it because there's a lot of powerful players that don't want them to. But what really is the problem here?
The problem is that we don't have free market forces working in competing for this business, this huge business of distributing drugs. There's a small number of these pharmacy benefit managers, 3, that run nearly 80% of that business in our country. And they're able to operate without transparency. And then they have basically 3 jobs. They're supposed to manage your formulary. So yes, the drug can go on the list. Here's what the copay is. They're supposed to adjudicate and pay drug claims. When somebody goes to a pharmacy and gets a prescription, they're doing some claims processing around that transaction. And then the 3rd job they were tasked with was negotiating drug prices. They used to do all of those things and earn a per script fee for doing it. So each time a drug got dispensed, maybe they'd get $1. That's many years ago. You fast forward to today, and the lack of transparency that exists has allowed them to continue to add more and more fees for their services. I looked not too long ago, and it was up to 41 different ways that we could see that they were inflating the cost of drugs. So now they represent, even though they're supposed to be advocating for the health plans they're a part of to get lower costs, they're adding 30, 40, 50, 60% to the cost of the transaction. So we're way far off track on this. It doesn't ever, and I think to your point, there's a lot of lobbying power with this industry, so it doesn't seem to get addressed in a real substantive way. This conversation on Capitol Hill is around letting Medicare negotiate directly with manufacturers, and I was looking at an analysis of potential outcomes for that, and it might shave 3 points off of the industry's total revenue if they do this. So it's a big conversation for 3%. if they were to require Medicare and other big purchasers of drugs, big health plans, to have an open process where pharmacy benefit managers competed for their business in a transparent way, in a free market way, they would sharpen their pencils and compete with each other and find ways to be more efficient instead of the opposite situation that we have now. And I think that would be that would have the potential to really drive down costs. When you see private health plans do that, they're able to literally cut the cost of drugs in their health plan in half. And they can do that without limiting access. People can continue to go to the same pharmacies and get the same drugs. And there really isn't any reason other than lobbying power that couldn't be done with the biggest purchaser of drugs in the world, Medicare.
And Paul, often when we hear about controlling the price of drugs, the government trying to control the price of drugs, we're told, well, drug manufacturers, then they're not going to develop life-saving drugs anymore, or at least not as fast. Is that a legitimate concern under price controls, or is that the drug companies just scaring us?
Well, the industry always comes back with that as the reason why there shouldn't be change. But when you look at, say, that insulin transaction where 60% of the cost is being added by players who do not manufacture drugs, do not wholesale or retail drugs, then you have to look at that and say, okay, that doesn't necessarily make sense. Those dollars aren't supporting R&D currently. If we could cut the cost of drugs in half without impacting the revenue of the manufacturers, which we can, then we've got that. We need to have a more serious conversation about this because it has a lot more. There's a lot more to it than just coming back and saying, yeah, we're going to stop R&D. We could remove 60% of the cost of insulin and not impact the manufacturer at all.
That is amazing news, and it's why we need to get into the weeds with this topic sometimes with our friend Paul Seegert from PCS Advisors. Paul, thanks very much for joining me.